Hi everyone, it's Ash. I just wanted to do a little video. This is like the third time I'm trying to start it because something's happened every time. um, I wanted to do a video on how to draw your medications up, what it looks like, and that kind of thing. And then I wanted to give a little update on where my cycle week is. So right now it's Saturday. I went for an appointment on Friday and Saturday. Friday, my physician said that I would have to be, her opinion, that I would have to be stimulated all the way till Monday, and my retrieval will be on Wednesday. So I bought another $600 worth of drugs, and I went for my appointment today because at my fertility center, the week that you're stimulated, you start on a Friday. You do it Friday, Saturday, Sunday. Your first appointment's on Monday. Then you go on Wednesday. Then you go on Friday. And then you go on Saturday to make sure that they don't need to retrieve your eggs any earlier than they plan. So today, on Friday, they were my follicles were measuring between 12 and 14 millimeters. So that's when she told me that I'd have to be stimulated the full 10 days. It wouldn't be Monday for my egg retrieval. So today I went in, and they were all measured between 16 millimeters and 18. They grew like 4 millimeters overnight. So, which I'm glad they had that Saturday appointment, which they know what they're doing, you know. So, right now my retrieval will be on Tuesday, and then I have to go in on Monday for them to check my estrogen levels and measure one more time, measure my follicles. So, today is my last day of injections of the Menopur and the Gonal F. And then I take a Cetrotide in the morning, and then I take my trigger shot at 9:30 at night. The trigger shot has to be taken exactly at the time that they give it to you. So you pull it up a couple minutes before, get yourself ready for that big old needle to go in you, and you give it to yourself. It has to be timed correctly because at 36 hours you will ovulate all those eggs, and they go in at 34 hours. And they have you scheduled exactly when you're supposed to be there for your retrieval. And I guess, everybody that's getting retrieved that day is set at a different time away from each other, just so you can get in and get it done. So that's where I'm at. I'm a little upset that I had to buy $600 worth of drugs that I don't need, but the Lord has a plan in everything He does, and I'm sure there's someone that He has planned for me to give those drugs to. So, that cannot afford to buy those extra drugs right at the last minute, or somebody just to help them out, whatever the case may be. I'm not worried about it right now, and I may need it for another cycle, and then that can get me started until I can afford the next. I don't know. So it is what it is. Everything happens for a reason, and I don't doubt it and question it. So, anyways, let's get started. I can say before I do this that I've been extremely tired from all of this medication. And right now I do have 24 follicles that they could count growing on because my ovaries are very full. And they're really big so far. And I feel a little bit bloated. But I can feel like when I laugh real suddenly, or if I move real suddenly, or if I go to my side, one side, or whatever, I can feel my ovaries kind of twinge a little bit because they're so full. So I have to try to take it kind of slow with like sudden movements and things like that. My belly is a little bit swollen, but I'm kind of overweight anyway. So if I was skinnier, I'm sure it would be swollen looking. But I can feel it a little tighter, and it just feels full. The biggest complaint that I've had this whole time, I've just been exhausted. I have been a little more hungry than normal, especially for like meat. I guess I need that extra protein to help these little follicles grow. Like last night I ate a huge ribeye, and I think that may have helped them grow 4 millimeters in the night. Not only, the injections, but I was joking to my husband last night that the steak was going to help them grow and they're going to be ready to come out tomorrow. And I didn't realize, basically, I was just predicting my future there. So anyway, this one is the Menopur. I don't know if you can see it or not. It's not the best lighting in here. And this is the saline you mix it with. They have these Q caps. You can kind of see it like that. You take this, bring this open, click, flip your top off, and this screws right into there, and then you pull it out the package. Oops. So you take, of course you wash your hands really good first, which I've already done that. I just don't even bother with that big needle. You take this, you screw it right to the end here. I always push a little air in my stuff because it's easier to draw up that way. With my dosage, it's 1 ml. I got millimeters on mine. 1 ml of fluid. I was just a teeny bit more, just because I lose a little fluid sometimes bringing stuff out. Then you take your Menopur, your actual drug, which is like a, I don't know if you can see it or not. It's like a powder down in the bottom, and it's kind of like in a cake, so that's normal. Then you pop this right onto there, push your fluid in, just spin it around. Oh, and this is one of the shirts from Ayla and Caleb. I really liked what it's saying, "You make me brave," because these little babies made me brave to do all this stuff, which I'm okay with giving other people shots all day long, but it's not for me. But you should get one of their shirts to help them pay for their adoption. They're a beautiful couple, and I hope they get their baby soon. And I hope I get mine too from this. I tell ya. Sometimes I squirt in there again and swirl it again just to make sure I get everything out, which I'm sure I do, but that's just me being a little cray cray. Like I have some right here in the corner that I want to get out, and it's just being retarded, so sometimes I'll push some back in and then try to pull it out one more time. Okay, that looks good. So then you can just twist that right off. Unless you're used to pushing air out of syringes all the time, I wouldn't suggest you push that much to the end, just because you'll lose medicine. But I do it all the time. So they give you other little needles to go with it. These are little 27 gauge needles. These, you may be able to see it a little better now. 27 gauge needles. They're really small. They're just little baby sub-Q needles. They work great. You don't even hardly feel them. So that's your Menopur here. I guess I'm saying that right. I don't know. And then you have your Gonal F, which your Gonal F is a multi-use vial. So you have to scrub your top real good. And then they give you the syringes that come with these. Some, like Folliston and stuff, they give you, I'm sure they give you syringes too. Some places use a pen, kind of like an insulin pen. You draw up your mounting unit. These have the little marks on them. My dose is at 300 here, and they go in 37.5 per dose. That's how they calculate it. So normally, the plan was to have me on 225. So I would have had enough to carry me over till Monday normally. But according to my ovaries looking dense in the very beginning, she wanted to start me on 300 to wake them up. And that's where she's kept me the whole time. She hasn't had to decrease it because my estrogen levels have stayed so far pretty good. The one for Friday hasn't come into my portal yet, but of course they see it and dose me accordingly, so I know it's fine. But the last one that was done on Wednesday, I have in, it takes 2 days for it to come in to the portal. So that was 900, which is good. Once you get up towards 4,000, that's when they worry about OHSS. So I'm sure it's over 1,000 now, but and I did stop my period on Friday, so that was wonderful because we were worried about that with transfers. So you just stick it in there. I would say be careful if you have these vials. Twice I've put air in these, and when I pull the needle out, air comes shooting out. Weird, never had that happen to me before. And medicine come out. So be careful. You don't want to waste all that medicine. So I have that much left in this bottle, which I don't give myself that much. So I'm really getting upset that I have all those 2 other vials for $400. The Lord has a plan in it all. So I draw it up to 300, and just a teeny baby bit of below the line, because all of it doesn't come out, which I'm sure they account for that, but I'm not talking about like a whole nother line worth. I just do a little bit below the line, just because all of it. See how I just squirted it again, so all of it don't come out. You're supposed to use these syringes. Those syringes are the bluntest needles I've ever felt in my life. I've given myself an insulin needle when I was in nursing school just to see how it feels. Don't hurt. That thing, it feels like it's tearing through your skin. So, what I decided to do, which I don't recommend you doing this unless you just feel comfortable doing it, but what I did was I draw it up in this right here, so I know I have my 300 units, and there's no question about it, because you're not supposed to draw it up in anything except for this. But what I do, which was that, because I listen to them, what I do is I take my other syringes that I draw my Menopur up with, because I have 1,000 of them in there. I have them in there for the progesterone too, and I work at a hospital, so if I need more, or if I need more, she can just order me more through the pharmacy. It's not a big deal. I take this syringe that is drawn up correctly, so I know it's the correct dose, and I squirt it through here into this syringe, and I just make sure all the little extra juices are out of there. See, there's a little drop. So I'll just do that, and then be careful recapping these things. You stick yourself, but even if you do, it's your own stuff, so it doesn't matter. And then just be careful redoing it, because you don't want to push all your medicine out and then you screw yourself. And what I do is I put one of these non-hurting needles on, and I'll give it to myself that way. I get the same dose, so, and it doesn't hurt. And also, when I start to draw my medicine, I put my ice pack on my belly, and it has helped tremendously with burning. The Menopur burns just a teeny bit. It really doesn't hurt, just a little bit. You can just feel it. And the needles, I don't feel them going in with this. I've done it without it, and I do feel them going in. It's not like the dull, like this needle, but I do feel it going in, and it's a little uncomfortable. So I just put my ice pack on, and I sit on it with my stomach while I draw my medicine up. And most of the time, by the time I finish drawing the medicine up, it's fine. It's done cooling my belly and stuff. So those 2 are the ones that I give myself tonight. They asked me to do my Cetrotide in the morning, where some people do their Cetrotide at night. It just depends on the facility and what the physician wants. So that's what they do there. If your facility does something different or tells you to give it at night, then that's when you give it, because that's their preference. As long as you give it to yourself around the same time every day, that's what's really important. Because you don't want it to wear off, and then you ovulate all those eggs you've worked so hard to get. So, that's about it. I will, my husband's going to give me these injections, because I've given them to myself, and I let him give them to me, and he does a better job than me, and I give him sub-Q injections all day long. So, I'm going to let him do that, and then I will give you an update with my transfer on Tuesday and my doctor's appointment on Monday. And then I will have a, like with of him giving me shots and pictures that I've taken along the way. So what I plan now is I'm gonna do the the videos of him giving me shots and my son giving me shots and pictures that I've taken along the way and pictures at the egg retrieval and at the transfer. I'm gonna do a video with all of those together instead of doing separate ones. Kind of like a little memorial of our journey instead of doing separate ones. So I think that would be better and more special. So I appreciate you guys listening to me ramble on, and if you guys have any questions about the injections, you just let me know. They really don't hurt that bad, especially with the ice pack. So just my biggest thing, I wanted to let Robert be involved with it. One, so he'd feel more involved in the process, and two, because I'm not giving myself IM injections, and he needs to do them, and he's never given a shot in his life. So him getting practice with these sub-Qs have been great, and he's not going to be as nervous, and he kind of knows how it feels to stick something in my skin, and he's got his little technique down now. So unfortunately tomorrow, when I have to do my trigger shot, I'm going to have to do it myself. I work tomorrow during the day, and I get off at 7:30, and because I'm a travel nurse, I'm working 2.5 hours away. So I won't be home until a little bit 10 or 10 minutes after, something like that. So I'm going to have to pull over at 9:25 tomorrow night. Hopefully I'm in a good spot where I can. Not have to do it on the side of the road. Pull over, mix my stuff up, and give it to myself. The lady at the clinic marked me today. One for Robert, and now obviously I'm going to have to do it to myself. I'm going to be able to turn around and, see where I need to do it. But I'm just very nervous about putting it in my butt. I know it's not going to burn and hurt as bad as in your leg, because I've done one in my leg before for stuff. And so I really was looking forward to Robert doing that one. But he will do the rest of my progesterone injections, because after my retrieval Wednesday morning, I start doing the estrogen patches and the progesterone and oil, and it's an IM every day. That will be done way on into March, past my first pregnancy test. My first pregnancy test, my first beta test will be March the 3rd, according to my retrieval date. I have it all on a piece of paper that they gave me. So I don't know if I'm going to be able to not test for the 2-week period. I have every intention of trying my best not to test and just relaxing and having the time with the little embryos that I do have, whether it's a full 9 months or 12 weeks, whatever the case may be, or not get pregnant this time. I'm just going to enjoy the time that they are in my uterus and go from there. I probably will test, to be honest with you, but I will not test before 5 days past transfer, because it takes 5 days or so for them to really implant and start producing all those hormones and stuff. So I will probably test at 5 days post-transfer and then do one every day until then, until my beta. I don't know. Just kind of, I have to see how I feel after I do it. I can't say that, I'm going to hold off, I'm not going to set myself up for that. But anyways, thanks guys for listening to me ramble on again. I'll be praying for you guys, and I wish you guys the best, and that you guys can have your babies sooner than later. And I'll be still praying for you guys every night. See ya.